Okay, let's go.
Hello everyone, welcome back to my YouTube channel. Your wellness adventure starts right here. And for the fact that you're watching this video, it means that you have not given up on your health, you have not given up on your hormones, you have not given up on your fertility. And I'm here to tell you that yes, you stand a chance, 100%. So today we are going to dive into a crucial aspect of a woman's health, AMH, or anti-Mullerian hormone. Whether you're planning to start a family or simply understand more into your reproductive health, it's important you understand that AMH is playing a significant role. So many of us have done our AMH test and we are down, or we are happy, or we are confused. We don't know where we stand. By the end of this video, you're going to understand 5 things your AMH level is telling you. You're equally going to understand what AMH level stands for in your fertility and how you're going to interpret the result by yourself without mixing up the medical jargons, so you can clear up the confusions, know where you are in your health, and actually face it head on. My name is Intricacies, aka Health Therapy by NK. I make videos on PCOS, hormones, infertility, and your general well-being. So if this video sounds like what you're interested in, be part of the community by clicking the subscribe button. So let's get started. AMH testing is a vital tool when it comes to fertility assessment. It helps to tailor treatment plans and predict outcomes for patients, especially those that want to undergo assisted reproduction in cases of IVFs. But one thing AMH does not do is to predict your general fertility. No, it has to be correlated with other parameters before your total fertility outcomes can be predicted. So let's dive into 5 things your AMH result is telling you. Number one thing your AMH level tells you is your ovarian reserve. AMH levels, they are often used as a marker for ovarian reserve, indicating the number of eggs remaining in the ovaries. We as women, we are born with all of the eggs that we need. So when you check your AMH levels, it's going to predict the number of eggs remaining. Levels may suggest a decreased or diminished ovarian reserve, which could impact fertility. Secondly is your fertility potential. Higher levels of AMH levels may indicate a fertility potential. That is that your fertility potential is higher. That is your ability to actually get pregnant, maintain that pregnancy, even ovulate. It's higher. While low levels may suggest that it's reduced. That is your fertility potential is reduced. We're going to actually know the low and the high when we talk about the normal ranges, because it's not just about high and low. That value needs to fall within the normal ranges. Thirdly is your response to ovarian stimulation. This applies for women that are going for assisted reproduction. Your AMH levels can predict your response to the ovarian stimulation. Your higher levels of AMH level can actually show that yes, if you're stimulated, that your chances of actually releasing an egg is high. Your chances of you going through that IVF and coming out with a successful outcome is high when compared with someone with a low ovarian response. Hope this whole thing is making sense. All right. So fourthly is in polycystic ovarian syndrome. In fact, recent studies are beginning to include assessment of AMH levels when it comes to predicting if a woman has PCOS. You know, there is a Rotterdam criteria that exists for identifying or actually diagnosing somebody with PCOS, which entails irregular cycle, hyperandrogenism, that is high levels of testosterone, whether in your bloodstream, that is when you have done a test, or through the physical features like facial hair, husky voice, deep-seated acne, and anovulation. then or polycystic ovaries in one of the ovaries, then AMH has now been included. In women with PCOS, your AMH levels tends to be higher, but in this case, it tends to be higher than normal. So it's telling you a lot about your ovarian reserve and the quality of your egg. Your AMH level does not just say about the quantity of the egg, it equally predicts the quality of your egg. Finally, is in ovarian tumor monitoring. Some women develop tumor, especially in the process of you want to get pregnant, or just all of a sudden one of those disease conditions that women encounter. So when your AMH levels, sometimes they are higher than normal, it can actually say that a tumor is going on. Certain types of ovarian tumors, such as granulosa cell tumors, may produce high AMH levels, leading to elevated AMH in the bloodstream. So when you monitor AMH levels, it's going to actually help to predict, is this increase as a result of PCOS or as a result of tumor or as a result of other disease conditions. So next is understanding the normal range for your AMH values. The normal range now depends on the laboratory and the type of assay method they use in assessing the AMH. So in general, in women of reproductive age, AMH levels have their normal ranges between 1.0 to 4.0 nanogram per milliliter, or 7.14 to 28.6 picomoles per liter. This whole normal range depends on the lab and the assay method they are using. So once you get your result, just look and see if it falls. So in cases of you have an AMH levels ranging up to 8 nanogram per mil, 12, 20 nanogram per mil, you're not going to rejoice and say that your AMH level is high. It's higher than normal. It's abnormally high, okay? So when your values don't fall between this 1.4 or the 7.28 point, depending on the SI unit that you're using to measure, then you need to work on it to improve it. So let me know if you want me to make video on how you're going to improve your AMH levels. Let me know in